Good morning to some, good afternoon to others. Thank you for joining us. And this is what is our first kind of webinar talking about release and case processing. And in this particular webinar, we want to spend some time really talking about best practices and hopefully some suggestions and solutions regarding releasing young people from secure and congregate care settings as quickly and safely as possible. Because clearly during this crisis, it's not only a health concern for young people, but it continues to also be an equity issue. We know it's Black and brown young people, primarily boys, that are confined in these settings. And so although we're talking about this in a moment of crisis, we hope that some of the things that we're doing are really the foundation for long-lasting reform. And we know that it can be done. We know a lot of work is happening right now to get young people out of confinement. Just look at the 24% drop in admissions detention during the first month of the COVID crisis. So this first webinar, we're focused on some of those ways to break down the barriers. And we're excited to kick it off. And with that, I'll hand the presentation over to my colleague, Tom.
Okay. Thank you, Chiquita. Good afternoon, everybody. And I guess this event must be the highlight of my week because I not only got dressed, I shaved. And that is a very, very rare occurrence these days. So as I'm sure many of you are aware, we did a survey through JDI Connect to learn as much as we could quickly about the very near-term impact of the coronavirus pandemic. I don't want to go into great detail on that. There's lots of information about it on JDI Connect and on the AACF website. But there are a couple of kind of nuggets from it, or sort of a couple of insights from it that I think help to frame the work of this particular response team. So I just wanted to touch on those briefly. Can you go to the next slide, please? Thanks. So I read an article a week or so ago that was titled "The Impossible Has Already Happened." And that the title of that idea was kind of ringing in my head as I started to see the results from the survey that we did of JDAI sites. I think we expected to see a drop in the detention population during the month of March, just kind of anecdotally based on what we were hearing. A 24% drop was a much steeper drop than I think we were anticipating. It's hard to find a point of comparison to that, but it is really striking that if you look at that chart in the lower right, over the period from 2010 to 2017, when we looked at the national numbers and saw that the population of kids in detention falling nationally by 24% over 7 years, at that time, we thought that was a pretty rapid change. Look at the straight downward drop of that green line. That's what happened over about 30 days in March. And actually, that's not even one full month of impact from the pandemic. And now we were only asking about kids in secure detention. We know that those aren't the only kids who are confined, and we suspect that there are similar, maybe more or less pronounced, but similar trends to be found in other forms of confinement as well. And as we go through this process and think about what we can do to expedite case processing and get kids through detention more quickly, I think we need to bear in mind that a lot of those insights are going to carry forward to other areas as well. Would you go to the next slide? Thanks. So when we talk about managing the population in detention generally, we often talk about the front door and the back door. The front door is kind of how many kids come in, the rate at which they show up, and the back door, how quickly can we move them out the back door. I think we expected to see in March that there would be a very kind of sharp fall off in the rate at which kids were coming to the front door. We were a little bit surprised and definitely heartened to see that the rate at which kids were going out the back door was also increasing a little bit. And I think that reflects the really dedicated efforts of people in JDAI sites to try and sort of clear space to get kids out as quickly as possible in the very, very early days as this pandemic was starting to kick in. I think when we look ahead a little bit, we don't know what we're going to learn about the month of April. The next survey is going to be in a couple of weeks, and we should know sometime in mid or late May how April panned out. But I think looking ahead, we do know that if the rate of release snaps back to what it was before, and if the rate of admissions snaps back to what it was before, all of those gains are going to evaporate immediately. We're going to be right back to where we were in January. So, kind of keeping the intensity, keeping the focus, and keeping the progress on both the front door and the back door, I think is going to be essential to keep this heartening trend going. So the next slide, please. So when we look ahead to what we expect that next phase of response to this pandemic to look like, it's one thing to say we need to keep up the pressure, keep up the focus on moving kids through the system and kind of getting kids out the back door as quickly as we can. We expect that that's going to be harder. And we'll talk more about all of these reasons, but you can imagine some of the obstacles that the pandemic presents to getting kids released safely and returned home in a timely way. We can look at some very sort of early returns, and this is kind of preliminary data. Because you guys are special platinum members of the JDAI Connect community, you get to see this. You get to see this slide. But basically, we were able to compare respondents who told us that they had COVID cases among their youth and staff during the month of March, and compare those with the sites that had not yet had any COVID cases reach them. And what we could see pretty clearly, that the overall reduction in detention across both of those groups was very similar, almost exactly the same. But for the places where COVID was already present, it was much more a function of the front door, and the rate at which they were able to make gains or kind of sustain their level of performance on getting kids out the back door was much lower than the places where the virus had not arrived yet. I mean, you can't kind of look at this and say that it's causation, but intuitively it makes sense that some of the things that make it, that help to keep kids away from the front door as the virus starts to kick in are the very same things that make it harder to get kids out. So when we look ahead to what the next phase of this work is going to be, if anything, our ability to expedite releases, our ability to find safe alternatives to detention and to maximize our use of them, and to just keep the case processing work going, despite all the obstacles and despite all of the the things that the pandemic throws in our way, keeping the pressure on those things is going to be more important than ever when we look at what's going to happen with the detention population going forward. So with that, I'm going to turn it over to Jerry to kind of set the stage for how we're thinking about that sort of more concerted kind of double down response.
Hi, Tom. Thanks for that very significant data. Even though it's preliminary, it's very, very important. Your last slide stands out to me most, and that's continued progress will not come easily. When I think about that, I think about a crisis and how it works. It challenges us to think differently in the moment about how we do things. But it's a double-edged sword because it also makes us all crave to be normal again, personally and professionally. And so normal in systems means status quo. And systems are built to maintain status quo. They're built to maintain normal. And we develop those structures to maintain that status quo and that normal through policies, processes, practices, directives that we set up. And we as human beings have to work in that structure that's been set up. So that last slide really tells me that it will be very easy to go back to that old normal. So if we really want to intentionally move from crisis into a transformative process beyond COVID-19, then we're going to have to think, we're really going to have to examine how we talk about release, how we examine our release processes and practices. And in order to do that, we're going to have to move into a place where we have people with us at the table that can help us to examine our processes and practices, because we're working in a system and have been for a long time that says we must maintain that normal. So if we can change the slide to the next slide, you can see here in this Venn diagram that we have added the foundations of what we think would be the building blocks to move towards intentionally transforming beyond COVID-19 and taking these gains, keeping them, and transforming our systems into a new normal. In order to do that, we have to think about who can help us to process the information that we have extracted from this crisis. And that is the people most impacted by our system. That's the communities most impacted by our system and its processes and practices, the families and the youth themselves. And we have to think about how we can, many of our sites are coordinating with these groups of folks, but we're not doing it in such a deep way that the processes become transformative and we can move past new normal into the new normal. If we had been really deeply engaged with these folks, then we might have seen more of a movement towards dropping the detention, dropping the amount of youth in detention and in long-term facilities prior to this. We only realized how much we could drop it through the crisis. So what these folks bring is that urgency that we have during the crisis. They have that urgency all year long, every day, about their youth, about their families, about their community. They have the same needs that we have as system stakeholders, to keep their families safe, to keep their youth safe, and to keep their communities safe. So we have a lot in common, but we have a long ways to go on how to use that information. And right smack dab in the middle of that Venn diagram is race equity. Because if we individualize how we talk about youth, how we think about youth, we can start to really, truly address race equity. And if we don't individualize that, then we will revert back to, again, the system status quo that has us set up processes and practices that apply to each youth in the same way, which we used to think was fair, but now we know it impacts white youth differently than it impacts youth of color. So critical are the new partners, or a new partnership, a new type of partnership with the partners that we have at the table. So one of the examples you might think about as we move through the rest of the presentation regarding this is risk. How do we all think about risk and minimizing that risk so we can release youth into the community? This will take data, and we have to think deeply about that data, which we call analyzing that data. These partners are very, very important to have in the picture when we're analyzing that data. So with that being said, we want to move on to hear from Regina Mitchell from the Center for Children's Law and Policy, who is going to talk a little bit more about moving through those processes and practices that our system has set up to maintain status quo and how they've challenged that.
Thanks, Jerry. I appreciate you passing it off to me. Again, I'm with the Center for Children's Law and Policy. Just going to talk a little bit about addressing barriers to release. As you all know, when you registered for this webinar, there was a question that you guys could respond to talk about what are some of the challenges or successes that you're seeing with releasing kids during this pandemic. So we'll go to the next slide and talk about what some of those are. Of course, there's many legal barriers that sites are seeing. So we had questions such as, how do I ensure my clients' due process rights are being secured while we're doing Zoom hearings, doing court via Zoom. So some of those strategies that we want to talk about and how to address those and how different sites are addressing those. A lot of these will be delved into deeper as we provide more content and more webinars for the community to talk about some of these in a more deeper way. And we want to hear from the community about the successes that you're having and highlight those for others as well. So treatment continuity. You'll hear about some of the other teams later in the presentation, but there was a big concern about how do you, if a kid is in the middle of treatment, how do we continue that if the young person is going to be released to the community? You know, what are things that different agencies are doing to make sure there's treatment continuity once the kid returns back to their home amid this crisis? Looking at community supervision, we know that most people have access to smartphones, tablets, or computers, but how do you bridge that gap for communities or homes that don't have those accesses? Are we forging new partnerships? We know Verizon has come to the table and stepped up and said that they will offer a free Wi-Fi to some of the families. You know, creating new partnerships across the community and bringing them to the table so that we can access those as we deal with creative ways to supervise kids in the community. Living arrangements and basic needs, that goes along with inequality of resources. We know that, as Jerry mentioned, the equity issue as we're considering releasing kids back to the community and what that looks like. We know that some of these decisions will impact youth of color disproportionately. So what are those resources that we need to have to effectively support our young people in the community? I've heard from jurisdictions that are putting together care packages with not only food, but basic needs, and delivering them to the families in the community to help with some of those inequality of resources that they don't have and some of the basic needs that they have at the home. Family engagement. For those kids that have not yet been released, how are we creatively making sure that they're connected to family and that those resources exist so that they can continue that family engagement during this impact? We know this is scary for us being at home. Some of us are away from family and friends. How do young people feel in the community in our facilities who don't know what's going on with their families at home? So making sure we bridge that gap and making sure that families are engaged to young people that are still confined behind the doors. And then those other things that may come up that we haven't yet bridged the gap to. So if we can go to the next slide and talk a little bit more about case processing specifically, and delivering some resources so that you guys can make the right decisions on how to effectively release kids to the community. So on the resource page, these are several resources, and I know that Brian is prepared to share this PowerPoint after this presentation. So these are all hyperlinks to resources that are available currently on JDI Connect. So the first one, Timely Justice Improving JDI Results Through Case Processing Reforms, is an actual practice guide that was written by Bart Lubau that outlines step-by-step some of the things that you guys can do to improve your results and timely case processing reforms. One thing to note in this practice guide, there's an actual checklist for case processing reform planning. So a step-by-step how you go through to make some of these decisions. The practice guide, embedding detention reform in state statutes, rules, and regulations, that also has a section on reducing unnecessary delays and gives examples of how this can be done. A lot of the things that came to the surface in this practice guide are enacting case processing timelines for sites to go by. Putting in those 24-hour detention hearings, review hearings. We know with this impact with COVID-19, some of those have been actually heightened because of what we're dealing with. And some of those timelines have been sped up so that we can get kids released. So the Baltimore City delinquency cases, although it's November 2001 is when the first process study was done. They did the follow-up study in 2006. But this gives you an example of what one jurisdiction did to make some changes in their case processing moving forward. So it's a real-time example that shows you what was done and what research was pulled, what data reports they pulled to look at their case processing. as a study? And then after they made some changes, what did the follow-up show? So Indiana's case processing study and visualizing the data, this is a key one in showing how you can creatively show the data so that people who are not into data like we are and reading reports, how to visualize it so that it makes sense across the board for people that are looking at the information that you're providing. And so as we look on the right side for the first steps, you know, COVID may give you the opportunity to do some of these first steps that you didn't have time to do pre-COVID-19. So mapping your system so that everybody's on the same page as to how a case flows through your system. It gives you the ability to highlight what some of the delays are in the system and be able to come up with solutions to address those moving forward. What data report do you want to collect? Length of stay distribution graphs, bed space charts, and conducting a case file review as well, are some of the things that you may have time while we're going through this crisis to address some of those things moving forward, and case conferences. I know most people pre-COVID-19 were doing case conferences, but for those kids that still remain behind the doors in the detention facilities, how often are you reviewing those cases to see if you can take steps to make sure that those kids can be released safely to the community to continue their treatment? So those are just some of the things. So next we're going to do a poll, our first poll, to kind of help guide us as to what we can address next, so that you guys can have some content and some real life examples as to how some of the other jurisdictions are addressing some of these issues. So what obstacles are you currently struggling with? We wanted you to select those items that you're currently struggling with so that we can plan for the next webinar for you guys moving forward.
And thanks, Regina. And I just opened things up and I realized that I may have made a mistake here in the way the poll is set up. You're only able to choose one. So choose wisely and understand that you probably have several of these on here that you'd like to select. Feel free to, anything that you see or aren't able to put on into this poll, feel free to put it into the chat as well so that we can see that and raise up some of those. And again, go ahead and hit the response that fits best, and then as soon as we get most people in, it looks like things are slowing down just a little bit. I'll go ahead and end the poll and share the results. So if you'd like to participate, make sure to hit that submit button so that we can get you in. And then, all right, I'll go ahead and close it down and we'll share the results here.
Okay, looks like with the obstacles you guys are currently struggling with, community supervision seems to be the top thing that people are struggling with currently, followed by treatment continuity and inequality of resources. Family engagement is also a big one as well. So these are some of the things directly from your suggestions and also the responses that you did when you registered for this. We'll be going over to develop content that you'll be seeing in the next couple of weeks as to specific examples around those current obstacles that we can share with you guys. So at this time, we're going to turn it over to Jerry and Erica, who's going to talk about the big no's that we're seeing.
Hi, everybody. I'm back. My partner and I, Erica Groover from Baltimore, are going to talk a little bit about some of the things that are coming up in our sites around tough cases in the system. So if you can advance to the next slide. So we listed out four types of cases that pop up in our systems. This is not exhaustive, but that we're struggling with now in the crisis moment and prior to the crisis moment, that folks struggle with how do we release these youth in a way that maintains safety for everyone. And so the four that we came up with that we struggle with a lot are gun charges, any type of gun charges, adult charges. And referring back to what Gina was saying about case processing, there's a lot of delays when youth have adult charges. Human sex trafficking seems to be another one, and that in the sense that releasing the youth may lead to them continuing to be trafficked. Also, any sort of assaults with a victim seem to be really tough cases for us in our collaboratives, our sites, to think about. And I would encourage you in the chat or to kind of name some of the other cases in your sites that are like the big no's. Like folks always say, oh no, and we're not releasing that youth at this point in time. That charge is a felony, and that's what detention centers are for, is to keep that youth in detention and safe from the community. Because of the pandemic, we have seen in our sites some room to talk about this.
Jerry?
And I'm gonna, yes?
We had two come in through the chat. One was high profile cases that have lots of media attention,
Yes.
youth who sexually harm, and again, runaways, particularly if it's associated with trafficking.
With trafficking.
And kids
Yes,
who have
so
no place to go.
I think we can all relate to those as well, that especially the media attention, because I don't know about the rest of the systems, but I'm pretty sure that most systems tag that straight up to their directors, to the heads of their agency, to say this is a high profile case. And as we make decisions about this case, then there'll be scrutiny. There'll be tons of scrutiny. And there may have to be explanations about why we made those decisions. So all of these things make it much more complicated. Puts many more challenges and barriers into the queue of releasing youth. And some of the jurisdictions have actually released youth in some of these categories. And so we kind of want you to start thinking about that, and how are we applying JDAI values and principles to these youth in this part of the system? Are we still considering adolescent brain development? Are we still considering positive youth development? Are we still considering the traumas that these youth have experienced? And are we still considering case processing when it comes to these youth, and how it slows down considerably? And if the delays are really delays in actual legal activities, or are they delays because we don't know exactly how to move forward, and we're getting assessments, and we're having meetings and teamings and triages, and we're putting all sorts of barriers ourselves in front of these youth. How we use language to talk about these youth is really important, because if we say this youth is a dangerous kid, that can be a conversation stopper. What we might want to consider to say is this youth has a ton of challenges, and how can we mitigate, how can we go through these one by one and mitigate the risks for this youth, for releasing them into the community? Oftentimes we have a lot of time because these youth are taking longer to release from our facilities, but we don't take the time because we're using that time to release youth that are easier to release from the facilities. So I really think this is a category that we can get into a lot deeper conversation about. And we can, and again, the conversation has to be with the community, the youth, and the families most impacted by this, so that they can give us their perspective on how to minimize the risk and increase the success of release to the community. And that may mean looking into different kinds of community services as well. The other thing I wanted to mention is that there are barriers to success that we put in place. Like, for example, with some of the kids that we released, everybody called for zero tolerance for the kids. So if they did anything out of the ordinary, we could potentially put them back in detention immediately. Excessive conditions for release also do the same thing. You know, if we ask them to go to counseling, go to substance abuse counseling, and use multisystemic therapy with their family, that may be too much, but it makes us feel good to know there's so many supports in place. What are the supports the family can actually wants, and what are the supports that they can handle time-wise? And when do that amount of supports become detrimental instead of helpful? Youth actually not having, especially in COVID-19, not having access to multiple people who supported them in their life, which may even be outside of their family, like coaches, teachers, pastors. They might not have that, and we may have to work harder in COVID-19 and also transforming that into our new normal after COVID-19. How can we make sure that that happens even more so that these youth are really truly supported by an entire community, a network of people, instead of just their families, because families are part of communities. So these are the things we're thinking about when we're thinking about your system's tough cases and how we release to the community. And so Erica, my colleague from Baltimore, is going to talk more about an example from Baltimore, and then I'll talk a little bit about an example from Albuquerque on releasing the Big No youth into the community.
Good afternoon, everyone. Again, my name is Erica Groover. I am with the Office of Equity and Reform at the Maryland Department of Juvenile Services. And so not only do we serve the Baltimore JDOT initiative, but we serve the whole state of Maryland. So this strategy is listed under Baltimore, but we actually have used the strategy throughout the state of Maryland to more effectively communicate with the court, because what we were finding as we started to look specifically at cases, because we started to do detention reviews, committed placement reviews, and we started to see a lot of the judges kicking back our recommendation to release and wanting to make sure that we are providing as much advocacy and information for each of the youth that we can, because a lot of times some of the courts don't have comprehensive or holistic information about the youth, and just wanting to make sure that we're providing all the information that we can in that vein to ensure that we can advocate as best as possible, and our case managers are able to best advocate for youth within our system. And so we came up with the idea of the Uniform Court Memo to be released to all of our case managers within our state of Maryland system. And so this letter or this memo was mocked after or aligned with the court memo and the way that the court addresses the youth as far as what the information that's necessary in order for them to have what they need. And so the factors that were considered in the memo were the youth treatment program, medical history and health related needs, as well as the availability of family and or other supports within the community. And so making sure that, of course, we specifically in the letter or in the memo addressed COVID-19 as one of our, as the important thing, and that we wanted to reduce and mitigate some of the populations within the detention center, but also knowing that we're not just reducing it haphazardly, but we're actually taking the time to look at each individual youth, looking at the offense, but also looking holistically to make sure that we're also looking at what is the reentry plan, what are the supports within the community, is the family prepared and ready to deal with the child once they go back to the community, and making sure that our community detention staff have the appropriate things that they need in order to observe children if they are released to GPS or to community detention, and that letting the courts know that we will still be able to adequately monitor the youth within the community, and that we do have resources and things that we can use within the community as well. And also looking at the health and medical needs, making sure that we're looking at youth who have pre-existing conditions. We have a lot of youth in our system with asthma, and so that is a big health risk when it comes to COVID-19, and wanting to make sure that we're not unnecessarily keeping them in an environment that's unsafe for them, and maybe they are more safe within their family structure, where they can receive the proper medical treatment or have the proper medications that they need for their risk or their vulnerabilities. And looking at the status of their programming, a lot of the youth that we looked at to release were 90 days or more, and so a lot of them had received a lot of the programming that they needed to satisfy some of the requirements that they had within our system. And so wanting to advocate that they will be able to be successful with the community because they have received a lot of the programming, and then giving the plan as far as to continue that programming and what are the supports in the community that we will set up for those youth to ensure that they have the proper supports once they get back to the community. And most importantly, making sure that that family structure is ready and that they have the proper supports within the community, whether they have to go to shelter care, whether they're making sure that we're doing family checks within their homes and making sure that the home is appropriate to go back to. And so that this uniform memo kind of just had an overview of all of the child holistically, and making sure that we're providing all of the information necessary to the courts to ensure that they're not just looking at the offense, but they're holistically looking at the child, the programming, the community supports, and everything that is needed to successfully look at the child. And so that is one of the strategies that we have been using effectively within the state of Maryland.
So in Albuquerque, thank you so much, Erica, because what you said really brought up in my mind the Albuquerque piece on having community-based agencies that can help to support the families as the youth move back in reentry. They come back to the families, and especially during COVID-19, there are some community-based agencies in Albuquerque that are really working hard to maintain those relationships, even through electronically, with those youth and those families daily, sometimes a couple of times a day, just checking in. It is great because youth love texts, and youth don't mind getting a couple of texts a day. In fact, they kind of like it, of people that have a good relationship with them, just saying, hey, how's it going, or what's up, or what are you doing? And so community agencies, do we have the type of community agencies, and have we thought about helping them to be built in the community that employ people like credible messengers, people who have been through the systems themselves and understand the trauma that is impacted on their families from the system, the traumas that they already have, and the community structures that people are living in, and how that family can be supported or not supported within that community. And if those community agencies had credible messengers that understand all of that, they can really work with youth that are in the big no category, like youth who are chronically involved in the system, youth who are disconnected from positive supports in the community, youth who seemingly are beyond the reach of traditional social services, and youth who are seemingly resistant to change. And so for like gang involved youth or youth with higher risk delinquent activity, these type of programs that employ credible messengers, that develop these very mentor-like relationships with youth are very, very, very important to, and I think really critical to the big no release discussion. And unfortunately, as Erica and I were kind of talking about this presentation, you know, Erica talked about how some of these agencies that are more grassroots agencies often are losing their money right now, and they're laying people off, and you know, they may not be there after COVID-19. So we, as people from the governments that actually fund these folks in our communities, must look to these folks and say, how can we support them so that they can support our families and our youth so that we can release kids in this category safely into the community, so that the community is safe, so that the youth are safe, so that the families are safe and supported, and so that everybody can succeed in our work. So these are the kind of things that we need to think about. And if you go to the next slide, we have, like, we put down, this is a quiz. So if we put down 4 of the strategies that you might be interested in exploring more when it comes to youth with big no charges. And I believe you can probably only pick one at this point, but then again, if you feel really strongly about another or all of them, please put it in the chat. And so if everybody can just kind of click on that and give us an idea about what you would like to see in upcoming webinars, we can bring information to you from all across the country and really deepen the conversation around the topics you're most interested in.
Thanks, Jerry. And people, it seems like you've gotten the hang of things with the poll, and the responses are coming in a little bit faster this time around. So just a reminder to select your answer and then hit submit. I'll just keep it open for another couple seconds here. It looks like we have just a few more coming in. All right, I'll go ahead and close it down and then share the results.
Okay, so we're seeing that community supports needed to release youth with big no charges is really 45% of you said that was really, really important to you. The next largest category is strategies that challenge collaborative partners to think about releasing youth with big no charges. And I think that has a lot to do with how we see risk. So those 2 topics really go hand in hand. So we can really bring a lot of information to JDAI Connect about both of those topics. Many people were interested also in reducing racial and ethnic disparities. And the first 2 topics, if we delve into them correctly, will reduce racial and ethnic disparities. So we need to be cognizant of that as we move on. So thank you, everybody, for participating in that poll and giving us an idea of where to go next. Oh, and so I should introduce our next person. Oh gosh, Brian, I forget.
You're just handing it back to me.
Okay, sorry to clear that up. I'm sorry.
So I first want to just thank all of the panelists, Tom, Regina, Jerry, Erica, who participated on today's webinar. And then I also want to just thank our entire team that participated in pulling together this webinar. So that also includes Mark Soler from the Center for Children's Law and Policy, Nick Costolas, and Alyssa Beck. So thank you to our entire kind of release and case processing team for the work that you all have put into this panel, this webinar. So just, we want to, if you have questions, we invite you to kind of put your questions in the chat. We've been kind of monitoring the chat throughout the webinar and trying to respond as things have come up. So I invite you to do that. If there's a question that we don't get to before kind of the webinar ends, we will certainly review those questions and respond. You can also put questions on JDI Connect after this webinar, and we will make sure that the PowerPoint and the recording will also be available on JDI Connect. So, I think just in closing, I just want to review some of the things that we heard really on this webinar. We talked about really the tremendous drop in admissions that we've seen over the last 30 days. And as we move into kind of getting back to what is going to be the new normal, because I don't think that any of us want to go back to kind of our normal practices. let's just keep top of mind, like the high bar that was set in order to detain a young person or retain a young person in secure confinement during this COVID crisis. And let's keep that bar high, if not making it higher. Really, the criteria has changed because of COVID-19. We need to make sure that we maintain with that criteria that has kept young people out of confinement into the future. This is the foundation as a building block for where we want to go. And let's also remember, as we work to release young people, that we need to partner with families, but we also need to be mindful of the needs of families. It's not enough to just say we're releasing and then send home. Families have needs. We have young people who are coming from really traumatic kind of environments, and we need to make sure that we're wrapping around in the best way possible so that they can have a good kind of return home and stay home. If your jurisdiction is struggling with case processing, please make sure to kind of look at the resources that Regina referenced during her portion of the webinar, and be on the lookout for additional learning opportunities about case processing and how to expedite it in a better way. And then let's start to rethink the big no's. Is there a way to keep a young person in the community, even when there's been a more serious harm? And then let's explore that. Let's figure out how to keep young people in the community. We can hold a young person accountable and meet their needs without confining them to the most secure placement. Then we have a responsibility to try to do that. And you heard about two places, Baltimore and Albuquerque, that are rethinking how they're reconsidering the automatic need for placement when it's one of the big no's. So we know it's possible. We know there are places that are doing it. Remember, releasing young people and expediting case processing during the COVID-19 pandemic was generated out of a health concern. But this is really an equity issue, and we can't lose sight of that. We know that the young people who are sitting in these placements are Black and brown young people, primarily boys. And that is something we always have to keep in mind. This is about equity. The same way that we were able to quickly get them out during this crisis is the same way that we can keep them out and get their needs met in the community, and making sure that they're in the best possible, safest, healthiest place. I also want to just take a moment to remind you or share with you for the first time that we are just one of the COVID-19 response teams that will be kind of responding on JDI Connect. There are 4 other teams. There's a team that's focused on admissions, youth in custody, community supervision, and community wellness. So be on the lookout for future webinars from those teams or other kind of opportunities to learn, and be on the lookout for other opportunities that we'll be presenting on JDI Connect to learn.